panellists to commenters, and then we'll open the floor to questions from there. Thank you. So first of all, Stephen.
Thank you very much. I'll add to your early comments that it's very nice to know that Jonathan's rigour and vigour is being applied to the European Commission. And I agree with you that this is a heroic piece of work. I'm intimidated by the professors either side of me from saying anything very much about the econometric aspects and so on. I will observe that this is very much a black box sort of exercise, and whatever we believe about association and causality and so on, it doesn't tell us anything about how it's doing it. And I would caution that in looking at MDGs as estimates of performance, we've got a very a subset of the MDGs which are very different categories. And I think one of your footnotes even mentions that the enrollment figures are not a long-term output. The lead time for affecting enrollments is quite different from the lead time for affecting the health indicator that you've got in there, and so on. So there are various things that one can pick in about the detail. But I think it might be more useful if I comment on this basic problem we face of trying to justify aid, to give credible recommendations to people who are making decisions about aid. And it's certainly the case that people are quite demanding in their questions about budget support. I think often more demanding about budget support than they are about other modalities, and I think that's one of the things to bear in mind is what the counterfactual is. Going back to the GBS study that we did, some of the problems we found was that, quite apart from getting hold of data, was that the nature of the beast has been changing over time, and therefore an awful lot depends on the way that budget support is done. It's very artificial to compare budget support against other modalities without looking at both the design of budget support itself and the complementarities between them. And I know I'm not saying anything at all that you don't know perfectly well, but I think it's interesting that you sort of start off by saying, well, the detailed country case studies don't tell us enough. And then at the end you say, well, some more detailed country case studies would be a good idea. And I agree with all of that. That's not to say that the broad quantitative analysis isn't also relevant. We have to see how they come together. And to give you an example of the sort of things that come out with looking at budget support in more detail, I think the issue of sector budget support is important. Partly because at the time of the general budget support study, people were very diffident about even looking at budget support. There was an assumption at sector budget support. There was an assumption that this was going to die out, and that the only proper way of doing budget support was general budget support. And there was, frankly, in some quarters, a sort of assumption that budget support was self-evidently going to work. And I think we've got away from that, and I think there's more recognition now that even if only because of its political robustness and that sector budget support has to be seriously considered. Your chances of doing this kind of analysis that disaggregates by sector budget support are far in the future. ODI and Makara recently did some case studies of sector budget support, some of which would qualify as general budget support in your definitions. And what was interesting about it again was that I think three things that I'll mention very briefly. One, that how it interfaced with other modalities made a big difference to how it worked. The question of the design of it was really important, and things that may seem like very simple details, particularly the way that sector budget support is earmarked, and the question of whether it is earmarked in a sort of general way, saying we'll provide sector budget support, but we're not trying to track our money down to particular budget lines. If you do it that way, you get a completely different animal than if you try to make it traceable and say, well, we have to see where it comes out in the budget. If you do the latter, you end up with what you call budget support, but tends to end up like a big project with all the problems that has. So the design is really important. And then another thing that always comes up in discussions of budget support is the problem that you mentioned about, does it really get to grips with quality of services as well as expansion? And that remains an issue, but the sector budget support study talks about the missing middle. There's a tendency to focus on pouring funds in at the top, looking at outcomes at the other end, and not thinking about what happens in between to deliver services effectively. And that's a real challenge that all of us have. It's not confined to budget support, but it's something that we need to look at. So that's talking about how your study can be complemented by other ways of looking at things. But I think what you've done is extremely helpful.
Stephen, thank you very much indeed. Oliver.
Well, I hope neither Stephen nor Jonathan should feel intimidated. I think what I'm saying will complement what Stephen said, and I agree with most of what Jonathan has done. I think I have some comments on the general issue, but they're not criticisms of the actual analysis. As somebody who has never had any difficulty finding evidence that aid is effective, I am confident to accept the association. But it's an association which I would think is an association between aid and performance indicators. And it's consistent with the evidence that aid does contribute to growth, even in sub-Saharan Africa. It's consistent with the evidence that aid is associated with improvements in human development indicators, even in the lowest income countries. So it supports all of that association. I'm a lot more skeptical about whether it tells you anything about general budget support. And in particularly, I'm very skeptical of the attitude. It's not what's in the paper, but it is an attitude that many donors and others seem to have, that outcome indicators should be used, especially outcome indicators like MDG aspirations, should be used to evaluate aid modalities. General budget support does not have a direct effect on MDG outcomes. And I think this approach to evaluation, to me, it's a bit like the approach to evaluating managers in football teams. The owners have an aspiration as to where in the league table the team should appear. If the manager looks like he's going to get to that position, his job is probably safe. If he looks like he isn't going to get to that position, he gets sacked. It's not a very good way of evaluating managers of football teams. It's a lot worse when you try to apply it to evaluate aid, or aid modalities. Because what you have to think about is, well, what is the channel? What is the mechanism that links aid and a particular aid modality and an outcome that you're interested in? And Jonathan in the paper refers to some of the literature on aid and growth. As I've mentioned to him, I think a more relevant literature, which is papers that myself and Paul Mosley, with various combinations of authors, have done, is looking at the effect of aid on human development indicators. And in a nutshell, our argument is that the channel you've got to look at is that aid affects the allocation and the pattern and the level of public expenditure. It is that public expenditure, conditional on the effectiveness of the provision of government services, that has an impact on outcomes. And one of the results we get for low-income countries, which are the major aid recipients, is that there is a strong association between aid and the level of what we call pro-public expenditure, in particular health, education, and water, clean water, because they are the components of government spending that have the strongest impact on welfare indicators. And there is. Aid leads to an increase in those levels in spending in those areas in low-income countries. However, spending in those areas in low-income countries has a very, very weak relationship with outcomes because of inefficiencies and ineffectiveness of government expenditure. Aid, through other mechanisms, does have a positive association with outcomes. So the challenge there is that aid is beneficial. The challenge is, how do you make the spending that is financed by that aid more effective? That's where aid modalities can come into play, because in some circumstances you may feel, well, for this project it might be better to keep donor control over it. So we'll fund the project because we think that's the best way to deliver the outcome. In other cases they may feel, no, we're broadly happy with what the government is trying to do, so we'll give them general budget support. And you may have add-in sector support to focus on particular sectors. What all of this suggests is that just trying to look for the general, broad association between general budget support and MDGs is going to be very difficult. You have to look at what's happening in between. And then I'll just finish by highlighting two of the particular MDGs that Jonathan had data on, because some outcomes are more likely to be affected by increasing spending. Primary school enrollment is one example. It's a type of problem that you can increase spending and you'll deliver increased enrollment. And you find positive results there. But another area where that should also be the case by and large is clean water. It's not particularly expensive to provide a well in a rural area. And it's a good way of delivering welfare outcomes. So it's more problematic that you don't find the association there. And what I would suggest for extending this work is to try and look at these individual components, look at what happened to public expenditure and what was happening in the countries, and then you might understand what the relationship is on outcomes. Thank you.
Oliver, thank you very much indeed. Paul.
Like everyone else who's spoken, I think this is a definite contribution to the aid effectiveness field, and as Jonathan himself says, something which has not been done in this form before. I'd like to ask Jonathan 3 questions, which I hope will stimulate him to take the work further, assisted by the company. The first 2 of those questions relate to the desirability of disaggregating the different countries on which we've got information about the effectiveness of budget support. What you've done, Jonathan, is to make a comparison between averages of high budget support countries and averages of low budget support countries. But what I think would be fascinating would be to find out which, especially of the high budget support countries, have done especially well. You mentioned the case of Uganda, which we would expect, but even more fascinatingly, which ones have done badly, because if we can discover that and see the scatter of who's done well and who's done especially badly, then that may give us a lever towards the next question on from what you've done, which is causation. Now, the second point is one which Oliver has already made, and therefore I can be very brief, but this also is a plea to disaggregate, because what I suspect may be important is not only the amount of budget support which is given, but also the way in which it's distributed, and as Oliver says, what may be key to this is which sectors it goes to. So if you think it would be helpful, it might be sensible to split the analysis up, not only by high and low budget support countries, but by sector, and to see whether that gives us a key to effectiveness. The third question proposition is directly about causation, because it was fascinating as I read to discover that what has been recommended for aid donors by a lot of people actually appears not to be happening in this case. What's been recommended is that donors should be selective and that they should give aid not on a conditional basis, but rather to countries which they already trust. And when I saw that Uganda was the most effective aid recipient, I thought, no wonder that aid is very, very effective, because if large lumps of budget support aid are being given to Uganda and such like countries where we know that there's been a huge poverty reduction, then it is not extraordinary that budget support aid turns out effective. But then I came to what I find the most fascinating study, illustration in Jonathan's study, which is that when we look, and I quote, at the low quality countries in terms of the quality of their country polity and institutional assessment, the high aid recipients still outperform the low aid recipients. So it isn't just the Ugandas and the Rwandas and the Mozambiques, but also the less good performers, which are doing well. So it isn't just that the already successful countries are getting lots of budget support aid, and the causation is going from the amount of budget support to the aid flows, but also some appears to be going from the aid from the size of the aid flows to the effectiveness of those flows. So there is two-way causation going on. On the other hand, how is the causation happening? What inferences do you draw from your findings about the way the causation is happening? That's a question not just for you, Jonathan, for everyone. Thank you.
Paul, thank you very much indeed for those questions. And finally, Jasmine.
Okay. Thanks. I'm not half as much an expert as these guys, so I'll keep my comments quite short. I mean, first of all, I'd like to say thanks, because I think it's a really useful and brilliant piece of research, and if nothing else, it really sort of galvanises discussion on this issue, which is hugely important. I think particularly at this time when, as Jonathan's pointed out, there's less support for it. I take note of the fact that it is association, not correlation, but there are striking results there, and I think I agree with the other panel members. Some of the comments said before that it is complicated to look at outcomes and link them to MDGs, but I think the initial data analysis looking at the poverty indicators themselves that Jonathan does in the first sort of half of the breakdown of the report is in itself a really positive set of results for budget support. I realise that the debate's more complicated, but I think it's really positive. Clearly much more research has to be done. Whenever we have these kind of debates, there's always this sort of plea for more data, more research, more disaggregation of the data to make it more meaningful, and little of it ever happens. I think that this is an indication that we need to spend more time, not less, perhaps looking at what budget support is and how it works. I also agree that it's really important that budget support is judged on the basis of how it is done and its particular national context. A mix of aid instruments is always going to be necessary, so there's never going to be a plea for all aid to be provided through budget support. But I do think we need to look more carefully at what it can offer. Such a tiny proportion, as Jonathan has said already, of budget support, of overall aid is actually budget support. So, when we're looking at what perhaps plus 90% of overall aid is given through other aid modalities. So I think we really need to take a look at budget support and think at how, through its different sort of variations and mechanisms, we can look at improving it.
Jasmine, thank you very much indeed. Okay, it's a chance now to turn the conversation over to questions. If you have a question, can you just introduce your name, and if you have an institution affiliation, please let us know as well. If you have a question for a particular member of the panel, please let me know. Otherwise, I'll take questions particularly to Jonathan. We'll gather up a group, and then we'll take it away from there. 1, 2, and 3.
Sorry, thank you very much. My name's Desmond Wims. I'm a senior health specialist with the Human Development Group in DFID. I have just a few brief and simple questions, which I'm sure won't take much time. I'm just thinking about the work. The simplest one really is, but I'm aware that there's going to be preparatory work on country case studies running up to the HLF4.